Good morning, everybody. It's afternoon now. Welcome to the Advances in Research and Innovation stream of SNOMED CT Expo 2023. My name is Terence Sherd, and I am the Tooling Operations Manager at SNOMED International, and will be moderating today's session. All questions will be answered at the conclusion of the presentation. Online attendees, please use the Q&A button at the bottom of the toolbar, and internal people here in the room will be able to use a microphone situated at the back of the room. I'm now pleased to introduce Jung Byun from the Seoul National University, who will be presenting Mapping Traditional Korean Medicine Terms to SNOMED CT. Jung, thank you. Please proceed.
Thank you, Terence, for introducing me to the crowd. Hello, everyone. My name is Jung Byun. I'm a PhD student studying nursing informatics at Seoul National University in South Korea. Thank you for being here today, and I really appreciate this opportunity to present while I'm attending the SNOMED CT Expo for the first time. Today, I'm going to present my research on mapping traditional Korean medicine terms to SNOMED CT, which was conducted with my advisor, Professor Park. Introduction. Why would we need to standardize traditional Korean medicine terms? Since 1951, Korean health system has kept coexistence of Western medicine and traditional Korean medicine for the Korean healthcare system. Starting in 2018, there were national health IT initiatives like electronic medical record system certification, data-centered hospital, and K-Cure Library, which is a public cancer big data set in Western medicine. But traditional Korean medicine was not included in these initiatives. In 2021, there were some actions taken from traditional Korean medicine sectors, developing a traditional Korean medicine big data platform. It was to support data-driven research that facilitates evidence-based practice, to standardize traditional Korean medicine services, and to exchange traditional Korean medicine data for improving efficiency of patient-centered treatment. In addition, another initiative took place, which was development of clinical practice guidelines for traditional Korean medicine on 30 diseases in an effort of terminology standardization and evidence-based practice. Given those initiatives going on for the traditional Korean medicine, it was necessary to try describing clinical ideas in traditional Korean medicine with standard terminology, and to explore if SNOMED CT would be appropriate for traditional Korean medicine terms. So we had decided to select one target disease from those 30 topics of diseases, and we chose migraine. Migraine is a severe form of headache causing significant impairment to those affected, and it is 6% nationally and 10% globally prevalent. Migraine is also commonly treated with traditional Korean medicine, so we decided that migraine would be the right fit to be the target disease for this research. Therefore, in this study, we mapped concepts describing clinical ideas from traditional Korean medicine to SNOMED CT to investigate the coverage of SNOMED CT for chief complaint, diagnosis, evaluation, treatment, and herbal medicine concepts extracted from traditional Korean medicine, and to suggest strategies of how SNOMED CT ontology and content for traditional medicine can cover clinical ideas from traditional Korean medicine. So now moving on to a methods section. To conduct this research, we built a 5-step mapping process based on results from a previous study published in regards to SNOMED CT mapping. Out of 5 steps described here, we have completed so far up to step 4, which is mapping source concepts to SNOMED CT concepts. We are currently planning on conducting step 5, validating the map in near future. Step 1, defining the purpose and scope of the map. In this research, the purpose of the map is to explore whether SNOMED CT can be used to describe clinical ideas extracted from the traditional Korean medicine clinical practice guideline for migraine. And the scope of the map would be chief complaint, diagnosis, evaluation, treatment, and herbal medicine of migraine. Step 2 is about extracting terms. First, terms were extracted from Korean medicine CPG for migraine developed by the Society of Stroke on Korean Medicine in 2021. Among various topics covered by this CPG, we reviewed 2 chapters which were Introduction to Migraine and Recommendations to Extract Terms. The chapter named Introduction to Migraine had 5 sections, but we only reviewed 4 sections on definition, diagnosis and evaluation, treatment, and prevention and management. In this chapter, we did not go over the section named Current Clinical Status for Term Extraction. Another chapter named Recommendations provided information on various traditional Korean medicine treatments, so this was also reviewed to extract terms. Terms were extracted from the Korean medicine CPG for migraine in the following order of sections, which are definition, diagnosis, evaluation, treatment and recommendations, and prevention and management. The extracted terms were categorized into following domains: chief complaint, diagnosis, evaluation, treatment, and herbal medicine. Then we moved on to step 3 to pre-process the terms. In this step, out of all the terms extracted, we conducted meaning-based groupings and selected one preferred term. This step was conducted to derive a list of preferred terms which became the source terms for mapping. Looking at this slide, you see all those different terms on the left side, which are different names for migraine in traditional Korean medicine terms. Out of these extracted terms grouped together, we selected migraine as preferred term and considered the rest as synonyms. When mapping to SNOMED CT, the term migraine was used as source term. Since the term extracted from the traditional Korean medicine CPG for migraine were in Korean, we selected English representation of the preferred term from Korean Medical Association's Medical Term Search 6th edition and Korean Medical Library Engine. Then we moved on to step 4, searching equivalent SNOMED CT concepts. We first filtered target SNOMED CT top-level hierarchy by domain as presented in this slide. This was considered in the process of finding a semantically equivalent SNOMED CT concept. Before moving on, there are a few things in purple I would like to highlight. I will talk about 1, semantic tag of pattern, 2, traditional treatment terms in the domain treatment, and 3, herbal medicine domain. First, in the domain of chief complaint, there were 2 different types of terms existed, which were signs and symptoms and syndromes. Certain terms which describe group of signs and symptoms are called patterns in traditional Korean medicine. These source terms could be mapped to concepts with semantic tag of pattern, which came from traditional medicine community content from SNOMED International. Luckily, I was able to access the traditional medicine community content in the browser, which is still in progress, and it already had additional top-level hierarchy called pattern, which specifically describe various traditional medicine-focused symptoms. In this slide, when you take a look at the syndromes in the middle, this could be the value of attribute associated pattern of disease, and syndrome itself could have attribute called associated finding, which would have a value of finding. Another thing I want to highlight is the traditional treatment terms. Before mapping traditional treatment terms to equivalent SNOMED CT concepts, we had to dissect different treatment terms into a unit of different treatment methods, procedure site, and traditional medicinal drug. This is because, first, different traditional treatments share the procedure sites. So instead of post-coordinating every source term leveraging SNOMED CT concept of traditional treatment terms and a concept for procedure site, information model was adopted to have both types of source terms mapped to each SNOMED concept under the top-level hierarchy of procedure and body structure. Second, specific type of treatment, which is puncture, requires specific traditional medicinal drug to be injected. So again, applying information model, traditional medicinal drug used in pharmacopuncture was attempted to be separately mapped to SNOMED CT concepts. Third thing I would like to highlight is about the herbal medicine terms. For terms within the domain of herbal medicine, we distinguished source term types to herbs and herbal medicine recipe. Since herbal medicine recipe is composed of different herbs used in making herbal medicine recipe, the source terms for both would be mapped to concepts in the organism top-level hierarchy. These were what I wanted to emphasize when it comes to source terms that are very specific to traditional Korean medicine. Then we followed this flow when mapping to SNOMED CT concepts. Using the international version of SNOMED CT browser, we first searched for a semantically equivalent SNOMED CT concept. If we were successful on this step, we would conclude that the source term is exactly mapped to pre-coordinated concept. If not, we would move on to the next question, which is about equivalently representing the source term with post-coordination. If successful, then the source term would be exactly mapped to post-coordinated expression. If previously mentioned two criteria were not met, then we had to find if there were any SNOMED CT concepts that could be broadly mapped to the source term. If successful, we consider the map correlation to be broadly mapped. Finally, if none of the above works, then we had to identify the source term to be not mapped to any SNOMED CT concepts. So now here comes the results. This table represents numbers of terms extracted from the CPG by section and term domains. We were able to extract 313 terms from the traditional Korean medicine CPG for migraine. As you can see, treatment and recommendation sections of CPG had the most number of terms extracted, and we extracted the most number of terms in the treatment domain. When counting the numbers, duplicates were not counted within or between sections. After pre-processing of identifying preferred term among terms within the same meaning-based groups, there were a total of 294 preferred terms identified. These became the source terms for the mapping. Now this table represents results of SNOMED CT mapping by CPG sections and source term domains. I wanted to make the table smaller because I wanted to bring together only the traditional Korean medicine focused results to go into details about them. Source terms describing patterns in traditional Korean medicine could not be mapped to any concepts from the international version of SNOMED CT browser. However, when looking into the traditional medicine community content browser, we were able to find 5 concepts that could be exactly mapped. As for the different treatment methods, 3 concepts were exactly mapped to existing SNOMED CT concepts. However, I also found another concept from traditional medicine community content browser that could be exactly mapped to one of traditional treatment source term, which was electroacupuncture. Unfortunately, source terms describing traditional medicinal drugs that is used with traditional treatment and describing herbs and herbal medicine recipe could not be mapped to SNOMED CT since semantically equivalent concepts did not exist. Now we would like to propose a few ideas to have wider coverage of clinical ideas of traditional Korean medicine terms. For concepts describing patterns, new concepts need to be added since there already exists the top-level hierarchy of pattern in traditional medicine community content browser. If a concept of pattern has more than 2 patterns, then the concept could be dissected by the unit of meaning and be mapped to each SNOMED CT concept of pattern top-level hierarchy. If a concept with a single meaning of pattern does not exist in the traditional medicine community content, it could be simply added as a new concept. When mapping concepts of traditional Korean medicine treatment, as I already explained, we dissected the terms into either treatment and procedure site or treatment and traditional medicinal drug and mapped each term to SNOMED CT concept accordingly. As for the traditional Korean medicine treatment concepts, SNOMED CT would need to add more new concepts to have more coverage of traditional medicine terms. Also, new concepts for different traditional Korean medicine treatment or concepts for grouping body structure terms or describing complex body structure would be necessary. Lastly, there are some concepts describing traditional medicinal drugs used for pharmacopuncture treatment. These concepts should be created as well to cover more clinical ideas of traditional Korean medicine treatment. When mapping concepts for herbs and herbal medicine recipe, we should add new concepts under organism top-level hierarchy describing traditional medicine-specific herbs. Since herbal medicine recipe is created in combination of various herbs, concepts for herbal medicine recipe itself could be covered by leveraging concepts describing herbs. With that, I also, in addition to what I mentioned before, we would like to suggest different approach of covering concepts for herbal medicine. Traditional Korean medicine provides 3 different types of herbal medicine, which are 1, pharmaceutically manufactured product, the picture in the left, 2, herbal medicine recipe, the picture in the middle, and 3, prescribed medicine from traditional medicine hospitals, the picture in the right. These 3 types of herbal medicine could be differentiated by looking at the photo provided on the bottom of the slide. If we were to cover not only herbal medicine recipe concepts, but concepts for both pharmaceutically manufactured products and prescribed medicine from hospital, we would need additional concepts with substance semantic tag. While herbal medicine recipe is brewed with different herbs, 2 other types of herbal medicine could be made with substances, like different ingredients. So to cover a wide range of different concepts for herbal medicine, we would like to suggest adding a new top-level hierarchy of recipe and adding new concepts accordingly. Then new concepts for herbs and ingredients could be the values for the appropriate attributes. So this concludes my presentation, and thank you for listening. If you have any questions, please feel free to shoot them away. Thank you.
Thank you very much, Jung. So Jung will now take some questions. As a reminder, if you're in the room, please step up to the microphone. And as expected, Jung, I thought you might have some questions there, so please feel free. But first question, please. Thank you.
I'm speaking this time with my hat on as a member of the ISO Traditional Chinese Medicine community. And I'm thrilled to see this work happening. I really would like to commend you for taking this type of approach. I think it's fantastic. I have two questions. The first one is just do you think we will also need to deal with the different preparational methods for herbal medicines? Because it's not just about the organism, it's also about what process is used either in the recipe or in pre-preparation. So that's more a technical question. And my second one is, how can this type of activity be coordinated with what's being done in the ISO community? You know, I think that's a challenge for us all, not to answer today necessarily, but I think we need to look at it because there's been some great work happening there, but they don't have some of the expertise we have here. Thank you.
Do you want Jung to ask his question first? Okay, Jung.
It's a great presentation, and it's an interesting case study. Really demonstrate the requirement very well. And I lead the terminology development for traditional medicine in SNOMED International. So we have done the pattern part, diagnostic, and the herbal medicine is huge. We haven't touched on at the moment, as he's mentioned about the ISO standard, and really talking about how you look at the top level category, and to in particular consider about the IDMP, the pharmaceutical standard already well established, and so there are kind of standard work required. And this is on one side, the challenge, let's say, big challenge actually. And also about the quite a lot of detail here. For example, the body structure anatomy side. One way to look at it, traditional medicine sometimes referring to body structure not exactly in the anatomical view. So that's why in the traditional medicine, that branch, we include the framework that may be different in different traditional medicine. So that is one thing you might want to consider. And procedure-wise, it's more about the operation. Those are kind of like a symptom and clinical finding. That is also we recommended map to SNOMED CT existing concept, because if you look at the WHO approach, is differently. They put those symptoms just like this patient has cough, but cough is different in traditional medicine and in the biomedicine. So that's actually build up a barrier for communication rather than help to communicate well. So our recommendation from SNOMED International is same as what you just did, to look at the existing content and how the symptom being described and already exist in SNOMED CT that actually can be used. You can add a synonym, and some may be more accurate, some maybe not, maybe require some additional new concept. And so there's quite a lot. So I just trying to touch on whatever I can think of. So I think there's go back to the complex one, the herb medicine. I think it definitely needs some kind of international collaboration to look at the concept model development and standard conformance. So all this work, I think is definitely a good starting point.
Thank you. Professor Park and Jung, if you want to jointly present your answers, that's great. Thank you.
Since Jung worked with me, so on behalf of Jung, I will answer to your questions or reply to your comment. Coming from Heather, I agree with you, because depending on how you prepare herbal medicine, it's a totally different thing. So I think somehow we need to have like some kind of a top-level hierarchy to include those concepts within the community ontology. I think that's a great suggestion. And how to coordinate with the ISO, I think that's beyond our scope of work. So I hope Heather and you guys work each other so that research like us, we could just follow whatever you have decided. And then the comment from coming from Jung, I think Jung showed some kind of graphics explaining difference between disease patterns and symptoms. So the pattern is combination of symptoms. So if we could have, a way of modeling what kind of symptoms are included in the pattern, that would be great, other than just having names of a pattern. So SNOMED modeling can be used to describe a pattern, with symptoms. I think it goes with that kind of theory goes with the anatomical site, because for traditional medicine, you are using a set of anatomical site or reasons of anatomical site to describe just one site. So again, we could, have the kind of modeling that these a specific anatomical site for this kind of traditional medicine is composed of this and that, that would be great. And I think the same rule applies to herbal recipe. If we have all the substances or all organisms, then we can model this is combination of this organism, or this is combination of this substance, and then we can kind of describe what we mean by this recipe. What do we mean by this pattern? What do we mean by this body site? I think that's how we need to go about in the future. And Jung just presented one example, but 30 disease. So clinical practice guidelines for 30 disease we mapped. So there are a lot of information that we could share, but there is no way we could share all of them. So this is just small, tip of our research. Okay, so any other questions or comments?
No, we've got nothing online.
Okay.
Thank you, Professor Park. Thank you, Jung. That was a very good presentation. Really enjoyed it. Thank you.